had several discussions where I've been sat down and talked to by one individual in particular who at one point pressured me to put evidence in my notes for the recommendations I'm giving. And I'm not giving anything crazy. I'm not pushing the carnivore diet on the patients. I'm just pushing an unprocessed diet on them. I got pretty good pushback to not tell my patients that, which was very interesting. I got pushback to say specifically the word plant-based. And it's funny because once I start including, references in these medical records, I got sat back down and said, okay, take those out of your notes. I don't like those sources. Heart study, the Sydney or coronary survey, the Sydney heart study. And it's just funny because they ask me to present the data. And as soon as I present it, it says, oh, no. That's not what UpToDate says. That's not the American Heart Association's diet. That's not the American Diabetes Association's diet. So stop recommending that.
We got Jacob here today. Well, good morning. Where are you located?
I'm in Wichita, Kansas.
Wichita, Kansas. Okay, very nice. Well, welcome. Thanks for taking the time to do this. Let me just, give you an opportunity to just kind of tell us a little bit about your background, if you don't mind.
Yeah. So I finished medical school in 2021, did a surgical internship. I want to be a pathologist, so I didn't choose flight surgery, but I did the HPSP program, which is a scholarship program so that, military can bring people in, and then they chose me to be a flight surgeon.
Got it. Yeah, I did something similar. Yeah, I did through the Air Force. Which branch are you in?
Air Force.
You're in Air Force. Yeah, same thing I did. Yeah, HPSP, and I landed up doing orthopedics. But so you did surgery. I mean, that's I don't think you need to do that to do path. I mean, that's kind of a different route for sure.
Yeah. So I kind of had a confusing route into my training. I matched during the COVID year and it delayed the military match. And so by the time I found out that they wanted me to do a internship only, it was kind of too late to apply for other things. So pathology was kind of taken off the table for me at that time. And so what was left was surgery prelim years. So,
okay. So where did you do that? And did you do that in Kansas or where'd you do that?
No, I did that in Phoenix, Banner.
Oh, Banner. Okay. Yeah, I worked at some of the Banner hospitals. I can't remember which one I worked. I used to do surgery at one of those Banner facilities. So where are you from originally?
I moved a bunch. I'm mostly from the Mountain West, Idaho region.
Okay. And went into medical school. And were you, your decision to go into the military, was that just so you could get the medical school paid for, or was it just you wanted to do that regardless?
That's part of it. My dad served, and my grandpa was in the Army as well. So a little bit of both.
Got it. Okay. Well, okay. So you're doing flight surgery now. So that's kind of primary care, basically, for people who don't know. I mean, it's you basically just. Where are you stationed at? Where in Kansas are you?
So there's a base here in Wichita, McConnell. So.
McConnell. Okay. Very nice. Okay. Well, how you liking it?
I like it. It's different than most primary care clinics. We get substantially more time. Our patient population is, our clinic capacity is smaller than what other clinics are assigned to. So, yeah, I like it. And as part of the job, I get to fly on occasion. So, that's a good bonus.
Yeah. Yeah. So what do they have up there? What kind of jets do they have, or what do they fly with?
Oh, it's a tanker base, so just refueling, things like that. So
okay, very nice. And then you're seeing, obviously active duty. Are you seeing also dependents and retirees as well? Is that part of your practice?
I don't see them. Other people that we do see on base are anybody with special jobs. Like we see some security people, missileers, and then we also manage the occupational health, public health programs. We'll have like an annual occupational health visit with certain shops on base.
Okay. You guys have missileers at McConnell?
No, flight surgery in general, we'll see those. We don't see any missileers here. So
yeah, because they're not. I don't think, because I was a missileer, and so I know I was in Warren Air Force Base up in Wyoming, Cheyenne, which is cold and windy. I don't recommend.
Yeah,
it's a nice place to live if you like the weather. Okay, so what brings you to our community? I assume there's some sort of nutritional component to this, I'm guessing.
Oh yeah. Long story short, I was an obese kid. There was a period where I rapidly lost weight and grew. And then later into adulthood, I just slowly started gaining weight. I actually went to officer training in like 5 years ago. I got some kind of viral infection. And then 2 months later, 40 pounds packed on. Didn't know what it was. I was just a second year med student. Found out it was Hashimoto's. My thyroid had died. In spite of working out, in spite of eating the right foods, this 40 pounds just packed on. I have a family history of autoimmune diseases. So I tried for years to eat what would be called a healthy diet. I tried exercise. The weight just kept packing. I started experiencing some gut issues. After getting on a stable dose of the thyroid medication, all the symptoms were still there. All the issues were still happening. And so I had heard you years ago in a clip, talking to Joe Rogan about being on an all meat diet. And being in medical school during the COVID years, I got a lot of time to, study on my own. All the rotations became virtual. And I bumped into Low Carb Down Under's channel. And it was interesting to see actual data and actual evidence for what really is healthy nutrition. And what seemed like a radical idea when I heard you years ago about being on an all meat diet started to make sense. And so 2 years ago in April of, what would that be, 2021, just went and did a routine checkup. My labs came back awful. I had the pattern B cholesterol. My A1C was pre-diabetic. I had poor renal function. All kinds of stuff was off on there. And I finally said, okay, if I want radical results, I have to do something radical. And so I went on the carnivore diet, and I haven't looked back since.
Yeah, interesting. So, I mean, the Hashimoto's that you're diagnosed with, because that can certainly impact blood glucose, and there's a pretty interesting correlation between thyroid function and diabetes and whatnot. And so, you said you were an obese kid. This is kind of interesting because there's this, new sort of, I guess, a new concept that they're saying, well, obesity is mostly a genetic disease. And, I tend to say, well, where was the genetic disease 50 years ago? That weren't, we weren't seeing that. So it seems to be more environmentally induced. And maybe that if what I think it is, if certain people are exposed to a garbage diet, they may preferentially put on more weight or distribute weight in different areas, but it's still the food environment that's driving this. And to say that, you, and I don't know what if your parents were obese or not, but you had, you lost weight and then you got a viral infection, wiped out your thyroid and gained it back. And so none of those sound like genetic components. So the effort to do carnivore was directed at just a general health situation. You're in the pre-diabetic, overweight, you've got some thyroid dysfunction. So tell us how did that go then? What's been going on?
First off, within about 8 months, I had lost 70 pounds.
70.
And 70. Yeah. I was 225. And then I got down to 152.
This is in medical school, right?
This was actually during my surgical year.
Okay. Well, and this is that was in that banner. Okay.
Yeah. So towards the tail end, April, was finishing the last part of medical school, graduated, and then started surgical intern year. You did surgical training. I'm sure a lot of people put on weight during that training, the stress environment and things. I didn't have time to exercise, so it wasn't exercise causing it. It was the diet. So the weight loss happened. The IBS issues completely disappeared, which was very interesting because in medical training, they tell you about how, red meat will rot in your colon. It'll give you all kinds of gut problems, worsen, all kinds of diseases. Just not the truth. Hashimoto symptoms faded away, which if anybody who struggles with low thyroid, they all know that fatigue, brain fog, difficulty concentrating are all parts of it. And it was like night and day. I felt a change in those symptoms within the first couple of weeks. So yeah, and lots of little things. There's odd things that seem to change you never noticed as a health problem beforehand, like dry eyes. That went away. Seasonal allergies, those went away. Dry and itchy skin, some eczema. I never had anything major with eczema, but it seems like every little thing got better on this diet.
Yeah, I mean, and you're certainly not the first person I've seen who said that. And so as a healthcare provider, and it's interesting, and I don't know, I don't remember them teaching me that meat rotted in my gut in medical school, but I mean, they certainly were promoting it. It was always kind of thought of, cholesterol is bad and it's saturated fat. And that's been in the indoctrination for many, many decades now.
Hmm.
When you were diagnosed with Hashimoto's thyroiditis, I mean, you have, antibodies, you have, obviously thyroid levels are out of whack. Has that changed from a lab perspective for you?
So I stay on those medications. I don't know if I want to experiment going off them yet. I've been in normal range for a while now. It was mostly just the symptoms that changed. My dose hasn't changed. My labs haven't changed. None of that.
Yeah. So
So
you had after with replacement, you were normal T3, T4, and your
yeah,
TSH normal, all those types of things. Okay, that's
yeah.
on replacement. Previously you were medicated but still symptomatic, so it wasn't cutting it, I guess. Is that fair to say?
Yeah.
So
Yeah.
now that's better. So maybe you'll be able to come off these. A lot of people interestingly have been able to. And then so the IBS, the weight loss, obviously. So I'm just wondering, because if you're doing a surgical residency, obviously you're in a civilian facility. So but the Air Force has got to be saying, hey man, you can't be 220. There's some standards you got to hit. And I don't know, maybe in the medical corps. I mean, they've never really messed with me that much. And I was always about 275, and I was just big, strong guy. I just kind of ignored them. I mean, one guy told me how to get down to 210. I just kind of looked at him and laughed. I said, I'd be like a skeleton at that weight. So, I mean, was there any pushback from the Air Force to lose weight while you were in your training? Or no.
So in HPSP, the only weight monitoring they do is they have you sign a piece of paper and submit it. And on there, you put your weight. And I put it on there. I definitely would give the low end of the estimate for my weight, but I never got pushback. I never got concern from them. When I wrote down, I think the worst I ever wrote down at one point was 210 pounds. Nobody ever said anything. I remember being concerned for MEPS and for officer training, but it honestly never came up.
Where did you do OTS at, was it Lackland? It's still down there, or where'd you do it?
No, I'm trying to remember the name of the base. I think it's Maxwell in it's in Alabama, Mississippi.
Okay, I think they might have moved. When I did it, it was back in Lackland Air Force Base. And it was with the basic trainees, so it was kind of like a combined, a lot of screaming and yelling, as I recall.
Yeah.
It was kind of interesting. So, I mean, and one of the problems with the military right now is they're having a hard time recruiting people because there's nobody that can meet the recruiting standards. So I wonder if they're just kind of slacking off. Obviously, in the medical corps, they're like, well, you're not going to be out there. You're not a frontline grunt. So, if you're a little fat, who cares? Kind of, you just got to be a doctor. So
yeah,
I'm wondering if that's the attitude now, because they don't have anybody else. But how does it, so when you went on this all meat diet, you're obviously you said you're in your surgical training.
Yes.
Everybody around you, because you're surrounded by physicians and nurses and all that stuff all the time.
Yeah.
Anybody looking at you going, what the hell? Why are you doing this? Why are you just keeping, why do you go in the cafeteria, keep eating burger patties, dude? What's up? I mean, what were they saying?
Yeah, well, it was only a couple people, like every single person I interacted with that had a question about it. And there were some religiously vegetarian people that definitely it threw them off they were my senior residents. So I had one person shout expletives at me for being a meatitarian, who was a vegetarian himself. Results don't lie. When I started the program, I was still 205, and they saw within another 5-6 months, I was down in the 150s. And I just saw my co-interns, some of them really packed on the weight. Some residents, on their badge, they have the picture when they start their intern year, and then they get more towards their 5th year training, and you look at their face in the picture and you see a huge difference of the weight that they've packed on. Whatever pushback I got, actions and results speak way louder than anything. And I had some people that were curious, but after a while they kind of kept their mouth shut, left it alone. So
yeah, it is for people that don't know, a surgical, I mean, for particularly intern year, I mean, that for me, that was one of the worst years of my life as far as not sleeping. I mean, I literally, so there were literally weeks where I logged 130 hours at work, which seems almost impossible. But I mean, I literally would work a 40-hour shift, go home for a few hours, shower, sleep for a couple hours, and come right back and do it again, and do it 3 times a week. So, I think that's 120, and then the next day you got extra. So it was pretty miserable. And then I just remember, I don't know that I gained any weight, but it was always, you were always didn't even have time to hardly eat, at least in my case. You're always kind of running, and it's got to eat when you can, sleep when you can, that sort of thing.
Yeah.
If you got time to eat, because you ain't gonna have a chance most likely. So, as you're doing this, Are you starting to see, I mean, because obviously you're seeing, now as a flight surgeon, I mean, you're seeing, primary care physician type stuff. You're seeing all these medical issues that come in, probably thyroid disease, a lot of diabetes, a lot of obesity, a lot of whatever, aches and pains. How does your knowledge of now nutrition affect your practice, or are you talking to patients about this stuff?
I talk to every patient about nutrition, every single patient. I'm obviously limited. I have some oversight in the clinic of people who are they're required to co-sign my notes for a certain length of time until I can do completely independent without oversight. And so I do have limitations on things I can legally say to people, but in general, I tell people to, cut out the bad things, the processed foods, cut out the grains, all this stuff. I have formally recommended this diet to one patient who's been experiencing some pan test negative bowel issues. But for the most part, I tell people, look, it's okay to eat red meat. It's okay to eat saturated fats, get them from real sources. Yeah, I do talk to every patient about nutrition. And this is a tanker base, and tankers are kind of known for being, the big boys. I'd say a good chunk of my population is either overweight or obese. I tend to get labs really early on some of my patients as far as age-wise, and I'm catching prediabetes, I'm catching pattern B cholesterols, issues like that, all signs of metabolic syndrome pretty stinking early. And it's interesting because these patients have been seen by providers who are on plant-based diets. They've been seen for years. Nobody's ever thought to get these scans. Nobody's questioned, oh, you're obese, but you're fine. I'm not going to ask questions. Nobody's ever tested them for things like metabolic syndromes. Nobody's ever told them to cut out the processed foods, to eat, red meat and things like that. But in all the notes, in almost every provider in the clinic, except for me, they'll put plant-based nutrition. They tell all of the patients plant-based nutrition. And so it's a little hard to be the sole provider in that clinic with a different mentality. So
I'm interested to see that, because in the Air Force, and maybe it's just specific to McConnell or something like that, that they would be so, just unilaterally across the board recommending plant-based nutrition to everybody. And I mean, as far as, I'm sure everybody gets a blood pressure check. So that's, one of the signs of metabolic syndrome is blood pressure. And then obviously they're obese. That's another sign. I mean, their waist circumference, and then obviously some of the basic lab panels of a basic lipid panel would show you, some of the rest of it. And so, obviously the tankers, you got more room. The fighter jets are smaller. That's one of the things.
Yeah.
Like when I was supposed to go up in an F-15, and they had to do all kinds of wavering because I was too tall, and this and that, and it was just like, so I never got to jump up there and go for a flight, which I'm kind of bummed about. But how is that, by the way? Well, you're up in the tanker, so you're not in the fighter jets, which would be a different experience, I suppose, because I guess from my understanding is that the fighter pilots like to go out there and pull a bunch of G's and make you puke. It's kind of soft. So the tankers can't do that, obviously. So, what is the frequency that you're flying? Is it on a monthly basis? You get a flight a month, or what's the status on that?
So I've done the initial flight surgeon training, which has a certain number of hours in different types of aircraft, but I actually haven't flown in the tankers yet. There's been an issue getting my my flying orders. But I've done all the other stuff, chamber, things like that. Part of our training includes a high G flight, and that was fun. Made me want to get a private license. But the tankers in general, they're fairly equivalent to the, a commercial jet, but the seats obviously are different inside. The space is different. You got to throw on oxygen above a certain level and things like that. The flight surgeon's role on those flights is pretty boring. We just sit in the back seat, and we're ready in case anything happens. So
as far as the food they're serving, I know there's some like special ops places where they were looking into ketogenic diets at one point. I know maybe it was in the Navy or something, but what is the general dietary pattern on the base? Do you go to the chow hall? Do you go to the DFAC? What do they call it, their dining facility?
No, I cook most of my own food. I've been in the DFAC a couple of times, just not having time to run home. It's the standard American diet there. They've got pizza every day. You can get hot dogs. You can get burgers. They have a healthy fusion grill where you can get all kinds of rice and noodles and things like that. But it's nothing extraordinarily healthy. It's just the basic standard American diet.
Yeah, I remember when I was deployed to Afghanistan, we had a huge amount of food there. I mean, KBR was a contractor supplying the food to the military, and they had ice cream and cake, and I mean, it was unlimited. You could eat all you want. I mean, there were just people there, particularly some of the civilian contractors who were just fat as a house. I mean, we'd have people walking around 350, 400 pounds. And I'm like, holy cow. And I remember one sad situation where we had a suicide bombing go off, and a guy had a big metal piece of shrapnel go through his brain. And he was just, you'd see the CT scan of this, just like it looked like a little rocket had shot through his brain. And he died because he was just, that injury alone. But I mean, he was just such a big guy that it was just kind of crazy. So you said somebody's overseeing yours. I mean, when you're saying I'm not pushing a plant-based diet, are they saying that's bad, or you're not supposed to do that, or how are they treating that?
Oh, I've had several discussions where I've been sat down and talked to by one individual in particular who at one point pressured me to put evidence in my notes for the recommendations I'm giving. And I'm not giving anything crazy. I'm not pushing the carnivore diet on the patients. I'm just pushing an unprocessed diet on them. And I got pretty good pushback to not tell my patients that, which was very interesting. I got pushback to say specifically the word plant-based. And it's funny because once I start including, references in these medical records, I got sat back down and said, okay, take those out of your notes. I don't like those sources, things like the Minnesota heart study, the Sydney or coronary survey, the Sydney heart study. And it's just funny because they ask me to present the data. And as soon as I present it, it says, oh, no. That's not what UpToDate says. That's not the American Heart Association's diet. That's not the American Diabetes Association's diet. So stop recommending that. Stop putting that in your notes. Sorry to ramble a little, but I got sat down by somebody who said we need to practice evidence-based medicine, and they went in and described what evidence-based medicine is, and then they said, so basically, whatever's in UpToDate is evidence.
Why don't you say, well, how about the patients get healthy as evidence?
It's hard. And I told one of the individuals, I said, a single well-done randomized controlled trial can completely undo our understanding of a topic entirely. A single well-done trial, and I said, would you rather have 1,000 case studies, okay, or a single randomized controlled trial where you double blind and control for all the variables with 1,000 individuals in it? Like, yeah, you might have 1,000 papers on your side with the case studies that say, plant-based nutrition, good. But in that RCT, that randomized controlled trial, you can't argue with the outcomes because they were controlled. And, a lot of our nutrition guidelines, a lot of what's on UpToDate, a lot of what the American Heart Association, the US dietary guidelines, all these big name organizations, they publish meta-analyses of things like food frequency surveys, the lowest quality evidence we could possibly find. I mean, even the social sciences don't have the gall to make wide sweeping recommendations based on questionnaires, but in medical science is adequate for recommending the diet for all Americans.
Yeah, it's very frustrating. And I wonder, because if you're not familiar as a physician, in California, they passed a new resolution where if physicians kind of question a particular guideline, then they're at risk for losing their license, which I'm just wondering if, the military takes a similar tack, which would be very, very frustrating because that's not how we derive the best outcomes, over time. You continue to test and refine, theories and because it's all theoretical. And, as you know, and as what I've seen, I mean, I literally see people every day getting tremendously healthy by, again, going on an unprocessed diet, including meat in their diet, and to sit there. I mean, it may just be specific to McConnell because I don't know what's going on in the rest of the base. But there isn't some Air Force wide policy. Maybe just because you get some of these people that are very religious in their belief system, and maybe I don't know what the position is. Because what are you, a captain right now? What is your rank right now?
Yeah, I'm a captain.
Yeah, captain. So you get some major, some lieutenant colonel with a little bit of a hard on for plant-based diets, and they're going to try to shove it down everybody's throat. And so it may just be unique to that particular situation. Hopefully it is, and it's not across the Air Force or military wide, because that would be an absolute shame. So back to your own personal stuff. So what about your parents and stuff like that, or family members? They had to have seen you at some point when you're 220 and now you're 150. Are they like, what the heck's going on here?
Yeah. So in Phoenix, I actually had a good chunk of family that ended up moving to that region, and they all saw it. They saw it before the diet, watched as I lost the weight, saw the improvement and everything. It's funny because people can't seem to believe their eyes anymore. They see I've got more energy. They see I'm, able to do more. I'm a happier person. I've lost all the weight. But then they'll say, well, when are you going to start adding vegetables back into your diet? When shouldn't you eat some fruit? Isn't fruit healthy? And just getting the questions. And, my mom, she's got lupus. And so I know a lot of autoimmune conditions respond very well to this diet. And, just getting such pushback like, well, I don't think I can eat a diet without vegetables. And, so I haven't gotten anybody who is willing to accept that what this is a healthy lifestyle, even in the family. But it's a little difficult that way. They see the results, but they don't want to investigate further.
Yeah, it's interesting because the sort of the halo of vegetables, we've been told, our mother told us to eat our vegetables, whatever, and their mother told them to eat that, and it's kind of like, I view it as kind of filler. I mean, it's certainly better than Twinkies and Doritos, but I mean, I don't know that it has any inherent super nutritional value outside of that. So the nutrients in them are harder to access. They tend to be less bioavailable. They come combined with, anti-nutritive properties that make them harder to absorb. They can be irritating on people's guts in many cases. Some people do fine with them, but to say that you must include them in their diet is, to me, I think, not based on reality. It's based on, a lot of mythology mostly, and some, like you mentioned, very badly done nutritional epidemiology, which is not it's just not a real good place to get your information from, but it still persists. When you talk to your patients about just removing processed food, how much success are you getting? I mean, are you able to make an impact there? I mean, is it just kind of like go in one ear and out the other type of thing? Or what are your thoughts on that?
There's an old proverb that says, when the student's ready, the teacher will appear. And so I'll talk to everybody about it. But if a patient isn't willing to hear what is being said, a lot of times it goes in one ear, out the other. I have had a patient who did a non-processed diet before, saw great success. And so when I chatted with him about it, he was very receptive. A lot of my overweight aviators, I give them a visual aid of cardiovascular disease risks. And then I give them a handout of what's called the NOVA classification of foods. They seem to like data more. All these flyers, they like charts and datas and schedules and checklists. And so the aviators seem a good chunk of the time to respond to that kind of discussion. But I haven't been practicing in the clinic long enough to see somebody as a follow-up. I do have a few that I initiated on lifestyle management a few months ago that are due to come in soon. But I guess the short answer is I don't have enough time in my clinic here to see the results of those yet.
Yeah, because you would have, I mean, residency would have finished, end of June, early July, and then you just, probably some orientation stuff you had to get through. So you're just basically getting started here. And so interesting to, again, the question is, can you get people to actually adopt and make the change? Because, it's great in theory, but that's the problem is if most people don't want to do it, then they're not going to. And it's really hard to get people to be motivated. I mean, I have an advantage that people, when I interact with people these days, they're seeking me out because they specifically want to make the change. And when you're faced with a bunch of random people, maybe 5% of the people actually care about it enough to do that. And so good luck with that. That's going to be an uphill battle for sure. So to lose 70 pounds, what were you eating? What kind of things were you eating, and how much and how often and that type of stuff?
Well, you mentioned earlier, in a surgical year, you don't have a lot of time to eat. So depending on which service I was on, the only time I'd have to eat is when I drove home, and I'd cook up, I don't know, I kept it very simple, burger patties, ground beef, on occasion steak. On an intern salary, you can't really afford a lot of meat, but eggs, kept it very simple. There's nothing wrong with bacon and eggs. There's a lot of times where, I'd cook a pound of bacon and that'd be my food for the day. So kept it very simple. Now that I've got more time for that, I'll eat about twice a day. I'll have a steak about 2-3 times a week. And the rest of the time it's ground beef, it's eggs, it's bacon, it's lamb. So nothing over the top.
How often are you eating at work? You said you're bringing your own stuff in and reheating it, or what are you doing at work?
So thankfully I live 5 minutes away from base. So I drive home for lunch. I'll just cook up some ground beef or something, some eggs, and then I drive back. So I don't often bring my food into work, but
And you said cognitively, you mentioned cognitively, you've gotten much sharper, as opposed, because I'm just imagining going through you go through medical school and you got some brain fog, and now it's clearing out. I mean, how long did it take you? Because you're in the middle of a surgical year. Did you notice a difference in your ability to think, and perform as a surgical intern, as you lost the weight, changed the diet?
yeah. So I transitioned. I noticed the effects a little bit before the intern year started. I had 2 rotations in medical school where I was on the diet, and my last rotation was actually critical care. And there I noticed a huge difference. Critical care is very detail oriented. It's data fire. There's a lot of things you have to look at. About a week into that rotation, I noticed the difference. Just the ability to, you're rounding with the attending. There's 20 people, especially in ICU rounds. There's 10 students, and then the attending will point at you and say, "Okay, what was their, I don't know, what was their magnesium today?" And I noticed at that point I could recall little details like that without having to look down and see if I had written it down or not. So that's kind of when I noticed it, just maybe a month or so in.
Yeah, I remember the days of rounding with the giant troops. It's kind of an interesting way to do that stuff. But so, what about? I mean, obviously, I don't know. At McConnell, are they doing mandatory physical fitness training, PT? Is that something you're participating in? Do you do that once a week, or what's the story on that?
I'm assigned to a flying squadron, and so they'll do PT once a week. And it's kind of shocking how few people show up to that in a squadron of, so many people, maybe 5, 10 show up. And then our medical group will have mandatory PT, but a lot of the medical staff are on what's called profiles. Oh, I've got knee pain, I can't show up to PT, or like I think maybe half of our active duty medical flight has surgery in the last year. So yeah, I don't see a whole lot of participation in PT. But as far as mandatory together, I mean, the people that are self-driven, they do it. They'll publish it in our work chat. But there's a good chunk of people who they don't do PT. They never show up. The weight's packing on. You can see it. So
Yeah, it's kind of, I didn't like going because I thought it was a waste of my time, because I could train better on my own, because I was doing a bunch of jumping jacks and go run a little jog a little bit. And I'm like, I train a lot harder on my own. So
yeah,
I often would skip that stuff. But it is kind of sad that, you think about half the forces has a profile that says I can't exercise, which is just, you think about this is supposed to be. And I know the Air Force is not considered the biggest warriors. I mean, they call it the chair force for a reason in some cases. And I was there, but still, that's quite sad that you've got a military that is physically not much more capable. And, it reflects, the overall population in general, I guess, which, we're seeing I'm sure it's closer to 44% obese now, and 78% overweight, or something ridiculous. And I'm 72% overweight, some ridiculous number. So how long are you at this base? I mean, is it a three-year PCS, or what's the situation for you going forward?
So it's a minimum of 2, and designated for 4 longer. It's not set in stone how long. The hope is to try and match again, so I can do pathology training, and then from there move on. But real quick about the fitness stuff. So that's just our medical flight. That's a small group of like 10 people that half of them are on profiles. The aviators and stuff, they're a bit more equipped to do things. They're not quite on profiles as heavily. But yeah, it's just the absence at PT when they schedule it. So
Do you have to finish? I mean, when are you eligible to reapply to match into PATH? Or, I mean, are you still thinking PATH? I mean, is this primary care stuff giving you a thought that maybe I want to interact? Because obviously in pathology, you're not seeing a lot of patients. I mean, well, you are, but they're all dead. But I mean, or tissue specimens. So what is your thoughts going forward?
Well, I went to medical school because I found pathology, not the other way around. But the more I do this, I liked critical care a lot. And so, as odd as it sounds, I'm weighing whether I want to do something like internal medicine with a critical care fellowship, maybe do the CCAT teams, or if I should do pathology. Still pretty set for path. the cycle, I can apply again in a few months to start next year in the summer.
Okay. Yeah. I mean, I'm just thinking, like from a, if you look at nutrition plays a role. I mean, obviously pathology, it's too late because they're already dead. I mean, you're not going to be able to, or, whatever you're getting, you're getting a cancer biopsy or something like that. Or, critical care, it's not really the place to do nutritional counseling because these people are on life, basically intubated or whatever. So it's kind of interesting, as an orthopedic surgeon wasn't really the place to do nutrition. I mean, that's not really the place to be a nutrition purveyor, and that's why I'm not doing that anymore. But one of the reasons. But so it's kind of an interesting way it goes. When you were in medical school, I mean, was anybody else concerned about nutrition, or was there anybody else, like, is it all just here to pharmaceutical type stuff, or what was your? I mean, does anybody else think about nutrition while they're in school?
Some people, it's not a standard across the board. Most physicians get, a few hours of nutrition mixed with their biochemistry in the first few semesters. Sometimes it's even like a rush course in the first few weeks of medical school, and then you move on from there. And then you never really talk about it again unless it has a definite implication, like, oh, how do you manage, tube feeding in a critically ill patient? That's the only time it comes up. Or in patients with heart disease, eat a low-fat diet. Other than that, nutrition almost never comes up. If you had the gall to recommend that, for instance, a patient with diabetes should eat a low-carb diet, you'd get looked at funny. So
interesting. Yeah, it's sad to see, but it's worth the fight. And so we still have a lot of physicians out there. I'm happy to say are joining that, because it's an important type of thing. You said you'd lost all this weight, your IBS got better, your thyroid symptoms got better, even though you're still taking replacement hormone. Going forward, are you planning on doing any more like physical training or changing the diet in any way? Are you planning on adding anything back in, or what's the thought on that?
So I've tried. About 4 months into the diet, I was concerned about things like vitamin E and vitamin A. Try to add things in like leafy greens, and almost immediately had problems with it. And so I'm not going back to vegetables. I've had food where some vegetables are in it, but things I seem to tolerate are like onions, garlic, things that have been cooked to oblivion. As far as lifestyle, I'm not adding things back in. I was influenced heavily by Dr. Paul Saladino as well. So I thought, maybe I can add some fruit back in, and that didn't go too well for me either. That affected my gut very heavily. And then I noticed some weight gain with it too. So
it's, and I get for those people that can do that, that's great, but a lot of people can't. And that's why I don't blanket and make recommendations that, because there's people that saying you must do this, you must eat, whatever, this amount of carbohydrate. And I'm like, maybe not, do what works. So do you, as far as, like I said, if you do pathology, I mean, it'll be interesting. I mean, do you have any thoughts on doing kind of research on this type of stuff, or can you envision how you could do sort of research on this stuff based on, because there's some people, people say, it's processed food, it's sugar, it's these certain oils that people are cooking with or using in the diet. I mean, these oils are in all this processed food. Any thoughts on maybe doing some research?
So as a pathologist, we manage the labs, in patient facilities. So I would love if we could do like an inpatient study of, an elimination diet, for instance, on IBD patients, and then monitor their labs and be a consultant for that. If I do go the route of a pathologist, internal medicine, I mean, the training includes a lot of outpatient care, and most of the routes to critical care require that you do some kind of outpatient training, like renal or pulmonary, that combines with it. But I'm completely interested in research. If you look at the fragments of data that are out there, not put in the guidelines, I think there is a decent amount of data supporting things like the carnivore diet for many conditions. But right now, we don't have a lot of RCTs or inpatient studies or anything like that that's been supported or pushed through. So I'd love to contribute.
There's some in the works that I'm aware of, so it'll be interesting how the next couple of years roll out. So how does it feel to be done with that surgical internship? I mean, is it nice to be through that? I mean, now if you go back and do an internal medicine residency, you're still going to have, you kind of go back to some of that, just less sleep, more, call. I mean, it's, I remember the pager used to drive. I mean, I know it's probably on the phone now, but I mean, like carrying that pager around was just, you hated that. It was because you get called. I mean, I remember when I was, you try to get an hour of sleep in the middle of the night, and the second your head hit the pillow, the pager would go off. It's like they knew. They watched. It was like some sort of thing that, like, as soon as he lays down, we're going to page him.
Yeah.
But anyway, how's it feel to know that stuff?
Oh, it's good. Yeah, we had pagers. There's still pagers. 2022, we still have pagers as our, or we still had pagers as our main system of communication. Like you said, we clocked high hour weeks. They've improved because they made those hour limits. I don't know if that changed when you went through training, but it was not unusual to clock 90 to 120 hours as an average in a week. It was good I went through that because during COVID, I went to a DO school, in a town where there's 5 medical schools, during COVID. And a lot of my training ended up being virtual self-study. I mean, I did virtual psychiatry and cardiology. I don't know how you learn anything about that. So surgical year really gave me a lot of training and exposure that I missed in medical school. It was difficult, but I don't know. I came out a better person. It sucked, but I'm happy that I'm better for having done it.
Yeah, general surgery is a pretty good well-grounded because it's very much, a lot of physiology, obviously, fluid management, and there's a lot of stuff that goes into general surgery. And what I remember were the general surgeons were the kind of the meaner folks. They're kind of the assholes. What compared to some of the other surgeons, I mean, it was like the neurosurgeons were all weirdos. The cardiac surgeons were kind of not too nice either, but the general surgeons were kind of, the orthopedic guys were a little more chilled out, I thought. But anyway, when are you released from the thumb of these other overseer people? When is that? When do you get to do that? And I'm surprised.
A couple of months. The Air Force guideline says I need 6 months oversight or to see a certain number of patients, whichever is first. It shouldn't be too much longer, but again, we do monthly peer reviews, so people can open up, my record and the health record and see who I've seen and what I've said still. If a patient comes to me inquiring about things like the carnivore diet, I won't hesitate to, advise and give information and recommend.
How often does that occur, though? I mean, you have people come to you and say, "Hey, tell me about this carnivore diet. I heard about it on whatever, TikTok or something like that." Are you seeing that now?
I've had 2 patients, and a good chunk of the time they'll ask me, "Well, what do you eat?" And I say, "I'm glad you asked. Let's talk about this." And I keep pictures of my fat self and my current self on my phone, and I show them results. I tell them what improved. I say, "Hey, you have this issue. I had that issue. It got better with this. You can do this." I don't know. I've had, maybe 4 or 5 patients bring it up before, and I talk to them about it. But yeah, I don't have a whole lot of leeway and liberty to discuss right now. Air Force wide, there's not a plant-based push. Every clinic's pretty unique and different. It's just the oversight in this clinic seems to be very plant-based in what they recommend.
Yeah, they tend to be somewhat totalitarian in their belief system in some cases, at least in my interaction. There's a question to ask. You'd mentioned eczema. You said you kind of sort of had eczema, or you did or you didn't. Can you talk about how long that took to clear up if you had some?
Yeah, there wasn't a lot of it. It was mostly my elbows and just like, it wasn't an issue I realized I had until it went away. Just always was itchy on my arms. As far as time wise, I don't know, I'd say it took maybe two months to go away. Didn't take very long. The biggest reason I stay on this diet is the IBS issues, though. I don't know if people have a hard time understanding. If I eat that food, I'm going to be bedbound and crippling pain and then running back and forth to the toilet. Like that's a hard thing for people to understand. And so, that's my main reason for being on it. Little things like itching skin and mild, very, very mild eczema, I don't have anywhere near. On social media, you can see people who post their pictures of eczema. My heart goes out to them suffering their whole torso covered in it. I can't imagine. But most of the anecdotal stuff out there seems like, anywhere from 6 weeks, sometimes 6 months, it clears up. I don't know what you've seen personally, but
Yeah. It's usually we start seeing results within a month, and it may take 3 to 6 months to completely resolve in many cases, but that obviously highly variable. We are unfortunately running out of time, but it's been a real pleasure to get to chat with you and find another, newly minted physician that actually, is on the right side of the world in my view. But anyway, thanks for doing this. Are you doing social media stuff, or is that frowned upon within the military, or what's your thought there?
Yeah, I have an anonymous Twitter account. You may see my comments. I'm 50 caliper, the cow guy on there.
I have seen that one. Yeah, I've seen you. Okay.
Yeah.
50. Where did that come from? Where did that name come from?
I don't know. I was just screwing around. But, I heard Elon acquired Twitter and that it had changed. So I went on and just thought of a funny name. 50 caliper, like 50 caliber rifle, firearms. And then being on the diet, beef. It's just a funny name. I may unanonymize it at some point, but yeah, for professionalism's sake in the military, not doing anything too direct or public right now on social media.
I get it. Well, anyway, thank you very much, Jacob. Good luck to you, and wish you the best. And whether you decide to do path, critical care, internal medicine, or whatever, keep up keep doing what you're doing, man. It's awesome to see. All right, thank you.
Yeah, thank you.
Okay, folks, we will be back tomorrow morning. So everybody, take care. If not, I'll see you guys. Otherwise, have a good weekend. Thanks, everybody. Bye bye now.